Well, weight loss surgery is a tool that is used in the morbid obese population to help them obtain a healthier lifestyle. Morbid obesity is defined as 100 pounds over ideal body weight, or individuals with a BMI of 40. BMI is basically a body mass index that basically looks at the ratio of one's weight to their height. Also individuals that have a lesser BMI but have a significant comorbid condition, health problem, other health diseases that are contributing factors related to them being overweight. Some of these health problems that we speak of refer to diabetes, hypertension, obstructive sleep apnea, gastroesophageal reflux disease, stress incontinence, infertility. So the list goes on as far as the types of diseases that these individuals battle. And so what surgery then does, it gives them an option, a viable option, to allow them to obtain a healthier lifestyle, also to extend their life, but also give them a better quality of life. What's typically used is the body mass index chart, and basically what that does is just once again relates one's weight to their height. And so the chart that you can find on the Baylor website that you'll see will basically give them a ratio, and it just basically makes them a predictor of whether or not they are a candidate for surgical intervention. There are various procedures that are currently being used in this fight of this epidemic. So in the armamentarium of morbid obesity, you have the band procedures. These are basically plastic bands that are placed around the top part of the stomach that gives individuals early satiety. What I mean by that is they get a sense of fullness. They feel full sooner by restricting the amount of food intake, which gives them the ability to eat less because they are satisfied with smaller meals. The sleeve gastrectomy is another restrictive procedure which essentially reduces the volume size of the natural stomach. About 80% of the stomach is resected to give the individual a much smaller capacity, so therefore that restricts the amount of food that they take in as well. And then you have the Roux-en-Y gastric bypass, which is basically a combination procedure. What it does, it creates about a golf ball size stomach, but it also serves as a malabsorptive component. If you don't absorb all the calories that you consume any given day, with a combination of limiting the amount of food you take in through the restrictive nature, that's the way the bypass works. Typically all procedures can be done minimally invasive, and what I mean by that is through the advent of industry and technology, we're able to perform some of the procedures that were once done open, but now through instrumentation, trocars, cameras, to be performed. This allows the patient back to normal activity sooner. Typically patients are discharged within a 23-hour observation, so it's maybe an outpatient procedure or an overnight stay. Patients are typically back to normal activity within a week. Patients will typically lose anywhere from 60 to 85% of their ideal or their excess body weight within a year to a year and a half.